I'm a mom of two kids, a 10-year-old and a 12-year-old, who are super active in sports and school and just can't sit still, to be honest. Well, I had back pain for about 20 years. I was in a car accident in my 20s. I wasn't aware that I had lower left scoliosis in my back until I did x-rays then. The pain, it was excruciating enough. I wanted to do something about it. But I didn't want to sit on the sidelines of life and not be with my kids. The chiropractic wasn't working. Stretching wasn't working. Physical therapy wasn't working. I tried multiple physical therapists. I had the epidurals. I still attempted to kind of keep life going, and so we went on a road trip, and I couldn't do everything with the kids on that trip. They would go horseback riding, and I would stay in the VRBO. They would do paddle boating, and I would stay in the VRBO. By the time I found Dr. Osorio, it was hard for me to get from the parking lot to his office.
So when patients come to me and they say, like Alexa, who have pain with standing, walking, sitting, it's all because gravity is putting pressure on those levels, and then the nerves are getting compressed.
I had a herniated disc at L4, L5, and also at L5S1. He was excited because he was able to do something beyond what they could have done 5-10 years ago.
For me, surgery now is not as much of an art, it's more executing a plan. And what Carlsmed has been able to do through patient-specific technology is they're able to datafy the inner space of the different disc spaces. Now you can visualize it before you walk into surgery, and you can almost predict exactly what your outcome will be. With the aprevo app, you can actually see in 3 dimensions. You can move the spine and you can actually find the hole, the foramen where the nerve comes out, and see the pre and post-op plan.
He was going to be able to use a personalized implant that would help to address both the scoliosis and the herniations at the same time.
Many times with patients with scoliosis or even just your standard degenerative condition, if you look at the vertebral body, the actual bone, it's not a rectangle. But for some reason, the entire implant field makes only rectangular implants. Through the aprevo app, you can say with this implant, I want to make one side taller and one side shorter. So now you're really able to create something that's not only personalized in multiple dimensions in terms of the curves, but it's going to match the entire topography of the bone. When you fit an implant that fits like a glove or like a key in a lock into the disc space, you know that you're going to have the perfect interface between the implant and the bone, and that's going to allow you to achieve that fusion.
It made a lot of sense. Everyone's vertebrae are different, everyone's spine's different. Why shouldn't we be doing patient-specific implants when it's something you're going to have in your body for the rest of your life? It's been 1 year and 3 months since my surgery. I don't know if there's anything I can't do. We went to Costa Rica on a vacation. I went zip lining, I went river rafting, we went canoeing down the rapids, rock climbing, rappelling, all kinds of adventures and fun. Now I can go up the stairs, this big long staircase at the park, and go up the stairs with the dog, no problem. So it's pretty amazing what impact that's had.
It's why we do this, and it's why someone like myself really believes in using technology like this. She's skiing, that she's doing weights, she's doing the exercises that I asked her to do, and some that she's able to do that maybe I wanted her to stay away from, but that's okay. She's enjoying the fruits of a good outcome.
I'm just so glad to be back with my kids, be off the sidelines and be back in life.